Sadly, Onondaga County reports another COVID-19 death, now raising the total number of deaths to 106 in the county. News Channel 9's Andrew Donovan joining us live following the county executive's daily briefing. He covered a lot of ground. Andrew, where do you want to start?
Well, Christy, what's happening in Onondaga County is not too different than what's happening in Madison County in terms of the number of asymptomatic cases that are being confirmed. Of course, the Department of Health and the Grand and Chittenango confirming that so many of those cases there, about 43, are people who are asymptomatic, not showing any symptoms. Asymptomatic cases are something the county executive in Onondaga County talked about today. In terms of the recent testing, 44% of people 44% didn't show any symptoms. That means they're not coughing, not sneezing, no temperature, but they are positive for coronavirus. That's 44% of people that wouldn't even have been tested a few weeks ago before testing was opened up to everybody. So an interesting point to look going forward, how many people are getting the virus but not showing symptoms. The fear, though, is they can still spread the virus. The medical community still isn't totally sure on how easily they can spread the virus or how long you need to be in contact with somebody. Another thing the county executive hitting again today is about half of the people in the hospital in Onondaga County don't need to be there. He's working with the state to fix that problem. Here's what he had to say.
This is not sustainable from the standpoint that we know that there's COVID in our senior facilities, and we know that many of our seniors are going to need to go to the hospital, and so eventually your hospital percentages are going to keep going up and up and up to the point where the hospitals are being used as a dorm, and we can't have that.
The governor has issued an executive order that requires COVID-19 patients from nursing homes to stay in the hospital, not go back to the nursing home until they test negative. But that means, according to the county executive, they're sitting in the hospital without needing that level of care. So the county executive feels the nearly 80 hospital data point, the number of people there right now, is much higher than it actually needs to be. So he's working with the state to rectify that problem, Christy.